Hi everyone, we're back, and the topic for discussion is just today. This is going to be really short. It's osteoarthritis and fibromyalgia. Let's talk about osteoarthritis. It's a degenerative condition that affects the joints of the spine, hips, hands, and knees. It is considered to be the commonest form of arthritis, and may result in disability. There are surgical procedures which may help to improve mobilization of the joints. What would be the symptoms? Well, you get a lot of stiffness and painful joints, swelling as well. And just that feeling of every time you move that joint, it's really difficult and painful. You probably see older people limping around as the cartilage starts to wear down. It becomes more and more difficult to walk. Here's Mary. She has osteoarthritis. She's having a really difficult time walking. Her knee joints feel really stiff and painful. And please believe me, if you wake up with your knees feeling like that, you're not going to be ready to leap out of bed and run around. Some people just don't feel very motivated when they're just miserable with all that pain and stiffness. One of the alternatives is hip replacement. Some people get knee replacements as well. And some people just take medications and comfort themselves, whatever works best. Here are some of the interventions. This particular situation, this patient is receiving this is rheumatoid more than osteo, but it's also the same. It all applies for the arthritises. Treatment is directed at they get an exercise regime, and their medications like anti-inflammatory, steroids, and NSAIDs, one group of drugs. The problem with some of these drugs, like ibuprofen, they may predispose to bleeding. And with osteoarthritis also, same sort of thing, pain medications, rest and exercise. And some people actually do have joint replacement done. The diagnosis is usually confirmed with an x-ray. Blood tests are also done to confirm the diagnosis. And I guess that's all we have to say on that topic. We're going to go on to something called fibromyalgia, one of those conditions where people have like a chronic ache all over their bodies, and there's no specific explanation for it. The body just aches, and the desire to get up and do things just is not there. There might be an emotional side to this particular condition. There's some people under a lot of stress. This is their response to stress. It might be due to fibromyalgia is characterized by pain in the form of a dull ache throughout the entire body, tenderness at the joints. When pressure is applied, it may also these patients feel very fatigued. They wake up in the morning, feel like they've never been to sleep. It might very readily be due to depression, arthritis, lupus. It's not all emotional. There might also be something physical going on, and post-traumatic stress disorders. Some of the treatments indicated are like Cymbalta, Lycra, and NSAIDs. Physical therapy and rest is also considered to be part of the treatment, and some of the diagnostic tests include thyroid studies, CBC, the ESR, the erythrocyte sedimentation rate, and like I said, it's not all physical, and some of it might be emotional. Every situation is different, will have to be applied. I have to discuss that with the doctor and the patient and decide what's best. There's no cure-all for it, in other words. So have a great day. Hope you've benefited from this.